Guys, what's up on the YouTube channel and out there on the interweb? It is Dr. Dan and
Dr. Chai.
we got the amazing Dr. Chai who joined our practice last year, January of last year, right?
Mm-hmm.
Fresh out of New York Chiropractic College, which is now called Northeastern College of the Health Sciences, I believe, right? So they rebranded since I went to school, but she is a fellow colleague from the same school, so we learned some of the same adjustment techniques and stuff like that. But what have you seen and felt since joining the practice?
Oh, since joining the practice, it's just been a complete 180 with all of the exercise and rehab stuff that we've learned.
Yeah.
I feel like I've definitely kind of revamped and upped all of that knowledge since coming out of school.
Cool.
Mm-hmm.
So we had a lot of active care classes, active care, passive care, right? Two different kinds of care. If we got passive care, you're coming into us, we're working on your muscles, we're adjusting your spine, maybe use the deep tissue laser, which is awesome for tendonitis and ankle sprains and ligament injuries at the elbow and the wrist, doesn't matter where your pain's at, deep tissue laser. But passive care is the hands-on manual therapy. So if you're watching the YouTube videos, you'll see us do a lot of muscle work on the neck, the mid-back, the low back. Sometimes we do some scraping with some with some different instruments, right? Some fascial release tools. But I think that what sets us apart here at the practice is the attention to how we want to create a healthy lifestyle for you guys overall. If you don't come into the clinic, that's awesome. You should be able to learn a ton from the YouTube channel. But also, as Dr. China, I think, has felt, the rehab is super important, and the performance training is pretty awesome, right?
Oh yeah, for sure. When I first got in here, like you said, it's a complete 180, 360, 180 of your lifestyle. I changed everything, the way I worked out, the way I would just incorporate more stretching, like a whole different stretch routine in the mornings. And I really have seen big improvements, not only in my flexibility, but in my strength. It's the most flexible and strong I've been at the same time.
Nice, flexible and strong. So you might have seen one of the other videos, we talked about the three kinds of people. The super tight person that can't move anywhere because number one, their brain is overwired in the wrong areas. And then we talked about the hyper flexible person, which probably, can really easily bend and stretch and do things, but maybe they just don't have enough muscle mass and we don't have enough strength to support our body. So you can have aches and pains for a couple different reasons. One of them is being too stiff, where things lock up. Maybe a disc may herniate, which is like the worst spine injury that you want to have. Maybe you have, some tendonitis or acute stress reaction. We hear stress reactions a lot, especially in the teenage athletes. Stress reactions could be avulsion fractures, could be tendonitis. You might have an MRI done and it shows that your tendon's a little ripped off your bone, and that's just because you're too stinking tight, right? The other kind of patient, the hypermobile person, the person that we want to build strength into. So your workouts with us have been fun?
Oh yeah.
Exciting?
Fun and exciting. They're different than your traditional regular lifting, right? Yeah. Regular lifting's a lot of linear work, just straight up and down, squats, bicep curls. Yeah. Here we train a lot more rotational movement, so I've really got to just work on that upper body rotation, all that stuff, just feeling all those muscles that I really couldn't connect well to before.
Yeah, nice. Yeah. Well, that's awesome to hear.
Yeah.
So I get to work out there 3, 4, 5 days a week over here at the gym and B Fitness. And, we see all kinds of clients over here in the office. We got people with knee pain, plantar fasciitis. You've seen the videos, you've seen the complaints. Hopefully you've seen some of the table-based rehab that we do. We're going to start updating the channel, so it's definitely more movement-based as we get into the new facility, which we're super pumped about. We're going to have 3,800 square foot of gym space. We're going to have turf. It's going to be an awesome training facility for both old and young athletes and people that just want to, start to exercise a little bit that have no idea where to start. So we just want to intro ourselves, talk a little bit about the lifestyle. The lifestyle is that you come in here with, your back pain or your headaches or whatever it is. And part of our care, it's two parts, right? It's part us, part you. And you've got to implement the stuff that we teach at home on a day, hopefully on a daily basis, whether it's the foot stretches, the toe stretches, some of the back chain power work, so that we can connect to the lats and the triceps.
Oh yeah.
Right? Yeah, cool. Add to that at all?
Oh yeah, it's definitely a two-man job, like we can get the work done, adjust you, loosen you up a little bit, but it's going to be up to the patient ultimately to maintain that through their exercise, their stretching.
Yeah.
Changes
So
stuff.
active care is super important. What we do in the office, we didn't learn at school. We've developed it ourselves through our own failures. You know, I used to get massaged once a month, get acupuncture once or twice a year, and I was getting adjusted every week, and I was just still stinking tight. I was so tight. My neck would tighten up, my back would tighten up, my right shoulder, you know, I broke my clavicle or my collarbone way back in the day. Dr. China has had double ACL surgeries, right? You played lacrosse, right?
Yes.
And
down at Slippery Rock.
Slippery Rock, nice. So right up the road from us, double knee injuries. Now she's sitting in a rocker. Plus she's got her Vivos on. She transitioned into a barefoot lifestyle.
Oh yeah, and honestly that really helped with my knee pain and everything, because I would still get an occasional pain every now and then, especially when I was working out. But I realized when I'm working out, I'm wearing these giant clunky shoes.
Yeah.
Can't feel anything.
No, so much rubber, right?
Yeah.
So we always recommend, you know, minimalistic training, barefoot training, postural awareness, super important. You guys are going to see how we adjust Dr. China. She's going to adjust me today also. You'll see our flexibility compared to some of the other patients that have come into the office. You know, pay attention to how well our knees bend. I might be a little tight today. I've done a little rocker so far. We'll see. She's got the killer lower extremity, man. Her legs, her back chains fired up. Her knees are nice and flexible now. We'll try to see if we can find any weak spots on her in our adjustment video today. But if you're in the Pittsburgh region, definitely give our office a call if you're dealing with aches, pains, if you want to up-level your performance, if you want to run better, if you want to lift the kettlebell better. You should see what we can do with the kettlebell. It's pretty amazing once you learn how to diaphragmatically breathe and strengthen your core. So, cool. If you got aches and pains, give us a call. We're here in North Pittsburgh. We're moving up to Cranberry in the next couple months to a nice big facility. It's going to have a lot of awesome modalities, and we'd be happy to work on you and help you on your athletic career, or just get you out of pain a little bit. Cool. Peace. Give our office a call. You guys can check the number at the bottom of the video. Shoot us an email. That'll be posted as well. Like and subscribe to the channel. You're going to start to see Dr. China adjust some people, and we look forward to hearing from you.